But anyways, through all of those years, married, had kids, I got interested in concierge medicine when my kids were little. Inevitably it would be 5 o'clock on a Friday and somebody had a temperature of 110 and you call the doctor's office and you get, whoever's on call, they don't know you, they don't know anything about your kids.
Yep.
And they're like, go to the ER. You end up in the ER. There's 12 hours of your life that you're never going to get back. And, maybe you needed to go, but maybe you didn't. It's just you really had no option. Obviously, there weren't other options that might be available now at the time. But I got interested in this idea of concierge medicine where you could call the doctor that you talk to all the time, that you have a relationship with, that knows you, that knows your kids, that can be like, Betty, it's fine. I'll see them tomorrow or I'll see them Monday. Don't fret. You just need that, conversation with somebody that knows you and knows your kids. And at the time, and there still is a concierge pediatric doctor in Pittsburgh, which I thought was really interesting, that doesn't have an office. He just comes to your house. So got interested in that. And through my own life, family, friends, really started thinking about primary care and the state of primary care in this country, and how important really good comprehensive primary care is. But right now, a lot of people don't utilize primary care the way it's intended to be used. I think probably all of us in this room would agree that our healthcare system is very reactive, sick care. We can have those conversations. Primary care is supposed to be that, but it's also supposed to be proactive and preventative. And we know that, with insurances, it's just not possible. These doctors are having to see so many patients in a day. They may have 8, 10, 15 minutes at most with a patient. How can you go through everything that's going on in somebody's life and try and be proactive and preventative and have those conversations with the patients when you have such a limited amount of time? It's not the doctor's fault. They're trying their best. And then, I talk to some people who will say, well, my doctor spends time with me. Okay, but his staff is now pissed. His or her staff is now pissed. All the people in the waiting room are pissed. Like, it's just the system isn't set up that way. So Connected Health, what we started was a concierge primary care doctor's office. So our doctors have time to talk to the patients. Our initial visits with our patients are 2 hours. You're sitting and you're talking to your primary care doctor for like an hour. I always say the good, the bad, the ugly. Like, we want to know everything because that's what goes into, who we are, how we feel, and we want to help our patients live longer, better lives. I was on a panel event the other day, and one of my co-panelists was talking about lifespan versus health span. And I thought that was really interesting. So our lifespan keeps getting longer, but what is our health span? And obviously, ideally, you want your health span to be really close to as long as your lifespan. But that's often not the case. And, I always talk about primary care and the importance of comprehensive primary care to get people to think about their health as an investment.
Yep.
And you want to get ahead of things. You want to talk about them before they happen. And, obviously, the younger you are, the better. So that's kind of the trajectory of how we got to Connected Health. We're 10 years old now, so we've been around long enough that we're not going anywhere. And like you said, it makes sense, right?
It does. And I will tell you, Rob, if you ever go into this building where they practice out of, it is perhaps one of the most beautiful facilities that you could ever. It's so welcoming, so clean, top of the line with everything. They treat you like family when you walk in as a patient to make sure everything is comfortable. It's, again, really the way that healthcare should happen in our community. And, we're blessed to work in such a healthcare-rich region of the country. But now seeing this take another step in a different direction that is more patient-focused instead of revenue-focused, I think that we're onto something here with Connected Health. So One more question before we jump into the break, and tell me a little bit about the demographics of your patient base.
Yeah, so we start around 8 years old. We want young people to stay with their pediatrician till they're through kind of their primary vaccines. But after that, we have patients from 8 years old to 100 years old. Right now, we have 2 full-time doctors, a full-time PA, full-time nurse practitioner, a nurse, MAs. It's really quite a comprehensive medical team that our patients get. And they get the chance to talk to their medical team pretty much 24/7. We have a HIPAA secure app that they can text. And whether it's 8 o'clock on a Tuesday night or Sunday afternoon, somebody's going to answer their text. You were talking about like with the Medicare renewals and companies that, are going to do very little work, but, they don't want you to ask any questions.
Right.
That happens a lot with doctors and patients. A personal experience of wanting to talk to a doctor and seeing them like at the doctor's office, seeing them in the hall, and literally they like ducked into a room because they knew I had a question and they didn't want to talk to me about it. And that's not who we are. We want our patients to talk to the doctors. We don't want to let them kind of go a year without having ongoing conversation. So we actually reach out to our patients. We call or text, check in, see how they're doing.
You realize because of all of the levels in healthcare, many people are really not taking care of themselves because they don't want to deal with this stuff, right, Betty?
Right. And they need help. And just like
and they need questions
need
answered.
Yep. They need somebody to respond.
Yeah, we got to break down the barriers of healthcare. That's really what we're trying to do.
That's what they're doing.
So at Connected Health, if you want to learn more, I highly encourage you check out their location, see all their practice and what they do. 724-933-4305, or you could go to connectedhealthpgh.com. That's all one word, connectedhealthpgh.com.
All right, short break. We'll come back with these two in just a couple of moments. But remember, those seminars, we're going to run them for you one more time after the break. But if you have anything that you need answered, the great thing about this show, every week we have live advisors standing by until noon. From the time we start until noon, 888-818-6334. That's what sets them apart from everyone else. This is the Inside Connection, MediConnect with Sean Horn and your Pratt Pack today on KDKA.
When you start your car, you can start your mind.
I think that it's important to be informed on what's going on.
If you don't have the facts, you can't think for yourself.
You got to figure out what's going on.
And accelerate your intelligence
with 100.1 FM and AM 1020 KDKA.
Why does Pennsylvania need the U.S. Steel Nippon merger? It protects thousands of union jobs. Nippon is committed to a nearly $3 billion upgrade of U.S. Steel's union-represented mills, including $1 billion to upgrade 86-year-old equipment in the Mon Valley. Nippon's cutting-edge technology to decarbonize the blast furnaces will make the Mon Valley's air cleaner, and it will help U.S. Steel reach its goal of being net zero emissions by 2050. All of this will increase U.S. Steel's competitiveness worldwide. And the merger also protects 1,000 headquarters jobs and keeps U.S. Steel in Pittsburgh, where it has been for nearly 125 years. Protecting jobs, modernizing steelmaking, and increasing competitiveness. Pennsylvania needs the U.S. Steel Nippon merger so we can keep steel in the Steel City. Paid for by U.S. Steel.
Pittsburgh is home to a lot of great people and great local businesses, and we're proud to be one of them.
Hi, John, Maggie, and Justin Schmutzer here from Metropolitan Window Company, Pittsburgh's locally owned and family-operated window company for over 45 years.
If you're looking to replace your old, worn-out windows with new, energy-efficient ones, then consider buying from a hometown business like us.
We're passionate about enhancing the beauty and efficiency of Pittsburgh homes using the top-of-the-line replacement windows, like our exclusive Infinity from Marvin 100% fiberglass windows.
They're the strongest, longest-lasting, best insulating windows you can buy. They're way better than vinyl.
And right now, you can save 30% plus get no interest financing on every window and door product we offer.
Experience the difference of buying from a locally owned, family-operated company.
Stop by one of our showrooms or visit us on the web at metropolitanwindows.com.
Or give us a call at
412-655-8411.
PA 1565.
Here's the latest from the KDKA Community Message Board.
Kick off the fall season September 21st and 22nd at the EQT Washington and Greene Counties Covered Bridge Festival. Enjoy an array of activities with the region's top craft and food vendors, reenactments, and entertainment. Plan your trip today at GoWashco.com. Looking to start your weekend early? Head to Rivers Casino every Thursday, Friday, and Saturday for live entertainment. Visit riverscasino.com for the full schedule. Join us and Glimmer of Hope for the Race to Beat Breast Cancer, Saturday, October 5th. Every dollar raised supports metastatic breast cancer research and programs right here in Pittsburgh. Remember, what's raised here stays here.
Keep listening for updates from the KDKA Community Message Board. Details at kdkaradio.com.
SchultzFord.com, 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 SchultzFord.com.
These are the people that make Pittsburgh work. This is Pittsburgh Works on 100.1 FM and AM 1020. KDKA.
All right, very interesting conversation with Betty. And, of course, Sean, we're going to get right back to it on the Inside Connection. But before we do, let's run these seminars. And I'm going to remind you, they are free, but you have to register to attend. You can call them at 888-818-6334 or go to MediConnectInsurance.com. Sean.
On September 18th, we have two seminars taking place simultaneously, one at the Northern Tier Library in Gibsonia, the other at the UPMC Connect Center in Monroeville. Both of those are 6 o'clock start times. On September 24th, we have two events at the same location, 4:30 and 6 o'clock start times. This is in place of the AHN McCandless facility. We have brought too many people, so we have to move it to the Ridgecrest Senior Living location, which is right behind AHN McCandless, 8870 Duncan Avenue. October 1st, at 6 o'clock once again, we're at the Holiday Inn Express right off of the Green Tree exit off the Parkway. October 9th, Seckler Law Firm up in Warrendale. Again, like you talked about, free to attend. We just need you to register so we know how much material to bring so that you could get the education you deserve as you approach Medicare for the first time. And we have been so lucky to be joined by Betty Rich from Connected Health, the CEO, the visionary behind the way that medical coverage should work in our community. Very happy to have you here with us again, Betty. And I want to jump right back into, you did a phenomenal job of explaining the backstory and how your model works. But what I'd like to really hone in on a little bit more is, who is this for and why? And I asked that because I just did a presentation up at your locations a couple days ago, had a lot of people there who were Medicare age needing to learn this information that we're able to deliver. But I also come to notice by just looking at the waiting room, there's a wide variety of demographic that is coming to you. So who is this model for and why does it make sense?
Yeah, one thing I forgot to mention, as a concierge primary care program, so we don't take insurance. Mm-hmm. So our doctors, we don't bill your insurance for the visits. Our patients can be seen however many times throughout the year as they want to be seen, need to be seen. They can come 40 times, they can come 4 times. And then, like I said, we actually encourage our patients to be seen and be part of the conversation. That's very important for us to empower and educate our patients to be part of the decision-making of their own healthcare instead of it just being a consumer and just being sort of handed, here's what you need to do, here's what you should do. You get to be part of that conversation. So who it's for is people that want value for what they're spending on their healthcare. I know over time we save our patients money. Yes, you're paying extra to join our practice. It's a monthly fee. Just so you have an idea, it's $235 a month for one person. But over time, I know that we save our patients money by getting their questions answered when they have them, by being seen on a regular basis, having this ongoing conversation about their health. Needing potentially to go to less specialists, less urgent cares, less ER visits, hopefully less days in the hospital, being proactive and preventative with your health. leads to lower healthcare costs. So that's something that's very, I think, hard for people to sort of wrap their head around, that yes, you spend a little bit more, but the experience that you're getting, the advice, the guidance, the all of that is so valuable. So that's kind of always, I say, for people that want value for what they're spending on their healthcare, people that are busy. A lot of times it's, moms with the kids and for their husbands, for their parents. Those are all people that, we help take care of. And it's very easy to make the change. I think a lot of Pittsburghers, we have a tough time with change.
But we do.
And so it's really easy. You call us or you check out our website, you fill out where it says schedule a consultation, and we'll call and talk to you and explain what we do, how we do it. And we'll do all the legwork. We'll do all the heavy lifting.
Well, and if I can ask you about that, because I think that's part that I really want to illustrate for our audience. So you become a new patient. They do this 2-hour appointment with you. But then there's a lot of homework that the doctor does on your history and what you're facing to really push on the right pathway. I would really want to talk about that, because I know that's innovative all by itself, because, you talked in the last segment, we're all reactive in healthcare. We go when we need something. We're not doing it because we want to, again, stay on track. So talk a little bit about the homework that your staff does when somebody becomes a new patient.
Yeah, I'm sure many of us have experienced going to the doctor's office and they grab your chart from, outside the door as they're walking in. And that's the first time they're looking at your chart and you're right in front of them. That's not how we operate. Our medical team are looking at our patients' records and charts ahead of time. We're getting your medical records from your previous doctors. We become the quarterback of our patients' healthcare. So we become the first call, and we will help our patients get specialist appointments if need be, or tests, or whatever it is that they need to have done. But we do all the heavy lifting. So it's really, really easy to become a patient, and we just take care of everything. What we do for our patients is honestly so far above and beyond, and it's really something you just have to kind of experience. And we encourage people to come to the facility, let us show you around, and see what it's like to have that kind of medical attention in a proactive and preventative way.
And it's revolutionary.
Thank you.
That's the word I love to use. I mean, honestly, if you're in the community and you want to experience different with your healthcare, have more hands-on approach, have some say in what goes on, Connected Health is the place to go. 724-933-4305, or you could go to connectedhealthpgh.com to learn more information. Betty Rich, CEO of Connected Health, it's been an honor to have you here. Thank you for what you do daily for the people of our community. And before we leave, one more time with the seminars, September 18th, we're at the Northern Tier Library in Gibsonia, as well as the UPMC Connect Center in Monroeville. September 24th, we're at Ridgecrest Senior Living, right behind AHI McCandless, at both 4:30 and 6 o'clock. And then one more special announcement. If you are a United States Postal Service retiree and you did not sign up for Medicare, until the end of September, you have an opportunity to sign up for Medicare for the first time and eliminate possible penalization. So if you fall into that category, you're a former USPS employee, you did not sign up for Medicare, you want to take a look at some of the options available, until the end of September, we can help you out with that. 888-818-6334.
If you would have kept talking, I'd have to ask you, what can you do for a leaky faucet? Because we'd have been doing the True Value show.
I'm sorry.
Well, you can handle it. I think you're so good. You can talk about anything.
I'm not as good as Andy.
Listen, it's a pleasure, and it was an honor meeting you. Keep up the great work.
Thank you. Thanks for having me.
Thank you, Rob.
See you soon, okay? All right, stay tuned. News coming up next.
The preceding was paid for by MediConnect. Information on the program is intended to solely further the public's general knowledge about the product. Opinions expressed should not be relied upon for any purpose by any member of the audience. Newsradio KDKA does not guarantee the accuracy of any of the information heard on the preceding program.
This is Larry Richard. Once again, we'll honor 5 individuals doing extraordinary things in the Pittsburgh community during our Hometown Heroes event on October 8th. Our Lifetime Achievement honoree is former Pirates manager, Hall of Famer Jim Leland.
Hometown Heroes is brought to you in part by North Shore Tavern and Mike's Beer Bar, Phase 4 Learning Center, McGuire Memorial, Performance Food Service, AquaGuard, JP Roofing and Siding, the Pittsburgh Pirates, Living Treasures Animal Park of the Laurel Highlands, and by Newsradio 1020 KDKA.
The Village at St. Barnabas, the perfect place for mom.
Hi, it's Paul Alexander with a great deal for my friends at Renewal by Anderson. Buy one window, patio door, or entry door and get the next one 40% off. Plus, get an extra $150 off each window and door. Now is your chance to save big on incredible windows, custom-made specifically for your home for maximum comfort and energy efficiency. Don't miss out on this incredible sale from Renewal by Anderson, your one-stop shop for superior quality windows and doors. Renewal by Anderson has extended their 31-day sales event. Buy one, get one 40% off all windows, patio doors, and entry doors when you buy 4 or more. That's 40% off. Plus, get an extra $150 off each window and door with no minimum purchase. Special financing is available. Call by September 30th. 412-448-9090, 412-448-9090. That's 412-448-9090. For offer and warranty details, visit renewalbyanderson.com.
Super September savings at Coons Market. Isn't that right, Frank Dentisi?
Right, Rob. Save with your Coons Reward Card. Center cut boneless pork loin chops or roast. Buy one, get one free. Washington State extra fancy apples are 99 cents a pound. And selected varieties of Green Mountain Coffee K-Cups, 10 to 12 count package, $4.99 each. Additional savings in our meat department, USDA Choice Sirloin Tip Steaks or Roast, $5.99 a pound. And wild-caught fresh Alaskan cod flakes, $9.99 a pound. In our produce department, Sweet Halos, 3-pound bag, $4.99 each. And red or green seedless grapes are $1.99 a pound. In the deli department, Isley's chipped ham is $3.49 per pound. And in our bakery, yellow or chocolate buttercream iced cupcakes, count package, $5 each. And this week, selected varieties of San Giorgio pasta, 12 to 16-ounce box, 99 cents each.
So get in all the Super September savings at Coons.